This is video 2 in the series on top tips to help you improve your pain symptoms, digestive symptoms, and low energy symptoms living with endometriosis. And in this video, I'm talking about a big topic, but something that's really important for you to address. And that is if you are extremely or chronically constipated or having chronic diarrhea. So I'm not talking about cyclical constipation or diarrhea, but something that's happening chronically almost every single day. Now, if you're having constipation, that's going to be a major source of inflammation for your body. So there's going to be a lot of inflammation in your gut, but that's going to affect you systemically. It's also going to make it really hard for you to eliminate hormones like estrogen and toxins and waste that can cycle back into your body, contributing to the severity of your endometriosis symptoms. And now if you're swinging in the opposite direction, loose stools, urgent stools, you're going to be losing a lot of nutrition if your stools are not formed. And this is nutrition your body needs to fight inflammation. Also, if the diarrhea symptoms are also coming with urgency or abdominal cramping, there's likely something pro-inflammatory at the heart of that. So I'll give you a couple tips here. Obviously, what's going to work and what's not going to work is dependent on what's at the root of this problem. First-line therapies for constipation are hydration, movement, and fiber. So you want to make sure you're moving your body, even if it's just gentle movement or some stretches. You want to make sure you're getting at least half your body weight in ounces in water. And then you want to be eating an adequate amount of fiber, ideally 35 grams of fiber per day if you're somebody with endometriosis. Some other little tips here could be things like ginger. There is a traditional medicinals brand ginger tea where one tea bag has over a gram of ginger per tea bag. Ginger is a beautiful prokinetic that doesn't just help with things like nausea and inflammation, but it also helps with that peristalsis along the bowel. Other tips could be things like consuming potassium-rich liquids like a coconut water or a celery juice. They're rich in potassium, and potassium is really important, again, for that peristalsis along the digestive tract. If you're not doing this already, you're going to want to space your meals. If you are grazing, so if you're eating every hour or 2 hour, you're actually kind of shutting your digestion down a little bit. Not exactly shutting the digestion down, but you are shutting down something called the migrating motor complex, which is this peristaltic sweeping wave through the stomach and the intestines. And that really helps to move food debris through the digestive tract towards the rectum for excretion. So you want to avoid grazing, and you want to actually have concrete gaps between your meals of 3.5 to 4 hours. And speaking of gaps, maintaining a 14 to 16 hour gap between the last meal of the day to the first meal the next morning is also a great way to support elimination. There are other digestive aids like Modal Pro, Motility Activator, SIBO MMC. These are branded products that can help with motility through the bowels.